and wonderful midwives, how we are doing. So today we are going to be having quiz, and this will help to assess the students' capacity and capability and comprehension from the last conducted simplified lecture. So tonight's quiz will be on immunization schedule. We just had the lectures, so let's know how many students will be able to get these questions, these past questions accurately in case of your Osce exam and sometimes your objective council questions. Now, I want you to share so that every student will join. I'm giving you few seconds to share so that every student will join. Number one question. Which vaccine is administered at birth? Which vaccine is administered at birth? A. Pentavalent 1. B. Measles, rubella. C. BCG, OPV0, hepatitis B vaccine, and D. Yellow fever. Which vaccine is administered at birth? Which vaccine is administered at birth? So we have A, we have the pentavalent 1 vaccine, B, measles, rubella, C, BCG, OPV0, and hepatitis B vaccine and hepatitis B vaccine. These are the vaccines that are administered at birth. Number 2, at what age is pentavalent 1 vaccine administered? A, at birth. B, 6 weeks. C, 9 months. D, 15th month. At what age is pentavalent 1 vaccine administered? A, at birth. B, 6 weeks. C, 9 months. D, 15 months. While we are using a live class so that you will be dropping your answers, so it will be interactive. In case you failed anyone, you will quickly take your correction. I come again. At what age is pentavalent 1 vaccine administered? A, at birth. B, 6 weeks. C, 9 months. D, 15 months. Now, if you choose A, at birth, you are wrong. If you choose 9 months, you are wrong. If you choose 6 weeks, you are correct. So pentavalent 1 vaccine is administered at what? 6 weeks. That is the correct answer. I welcome all the wonderful students to this life. Welcome to Nurse Brainy Academy. We always acknowledge God. Welcome to the live quiz. Number 3. Which vaccine are administered at 6 weeks? Which vaccines are administered at 6 weeks? A, BCG and measles. B, yellow fever vaccine and HPV. C, pentavalent 1 vaccine, OPV1, IPV, PCV1, and Rota 1 vaccine. D, tetanus and hepatitis B. Which vaccine is administered at 6 weeks? A, BCG and measles vaccine. B, yellow fever and HPV vaccine. C, pentavalent 1, OPV1, IPV1, PCV1, and Rota 1 vaccine. And D, tetanus and hepatitis B vaccine. Now, if you choose I'm impressed with the students that are choosing the correct answer. Now, if you chose D, you are wrong. Tetanus, wrong. If you chose BCG for 6 weeks, you are wrong. If you chose yellow fever and HPV for 6 weeks, you are wrong. If you are in the last conducted previous simplified lecture, you will not choose that. And if you chose C, which some students in this live section just chose, you are correct. So the vaccine that is administered at 6 weeks is pentavalent 1 vaccine, OPV1, IPV, PCV1, and Rota1 vaccine. Are we together? Yes, we're together. Now, number 4. Pentavalent 2 vaccine is administered at A, 6 weeks, B, 10 weeks, C, 14th weeks, D, 9 months. Pentavalent 2 vaccine is administered at A, 6 weeks, B, 10 weeks, C, 14 weeks, and D, 9 months. What is the right answer? Now, if you choose D, 9 months, you are wrong. If you choose C, 14 weeks, you are wrong. Pentavalent 2 vaccine. If you choose 10 weeks, you are also correct. So, pentavalent 2 vaccine is administered at 10 weeks. Don't forget this, pentavalent 2 vaccine using Osbrainy shortcut that I gave you in our class. Pentavalent 2 vaccine is administered at 10 weeks. All the wonderful students that are making attempts, I'm impressed with you. Number 5. When is pentavalent 3 administered? A, 10 weeks, B, 14 weeks, C, 6 months, D, 9 months. Pentavalent 3 vaccine, when is it administered? A, 10 weeks, B, 14 weeks, C, 6 months, D, 9 months. Now, if you choose D, you are wrong. If you choose A, 10 weeks, you are wrong. If you choose B, 14 weeks, you are correct. So pentavalent 3 vaccine is administered at what? 14th week. Is administered at the what? 14 weeks. Now I'm going to give you all 5 seconds. Now, a 10-week-old infant who received all vaccine at birth and 6 weeks should receive A, BCG and yellow fever vaccine. I come again. A 10-week-old infant who received all vaccine at birth and 6 weeks should receive what vaccine next? A, BCG and yellow fever vaccine. B, pentavalent 2, OPV2, PCV2, and Rota2 vaccine. C, measles and rubella only. D, hepatitis B only. A 10-week-old infant who received all vaccine at birth and 6 weeks will now receive which vaccine? A, BCG vaccine, yellow fever. B, pentavalent 2 vaccine, OPV2, PCV2, and Rota2 vaccine. C, measles and rubella vaccine, and D, hepatitis B vaccine. And if you chose hepatitis vaccine, you are wrong. It's wrong. If you chose A, BCG and yellow fever vaccine, you are wrong. If you chose B, pentavalent 2, OPV2, PCV2, and Rota2, you are correct. So the next vaccine that the infant is going to receive is B, pentavalent 2, OPV2, PCV2, and Rota2. Now, one of the reasons why we are doing this quiz is in case you are not getting this correctly, in case you are missing some, you need to go back to the lecture because you need to know this. Because in your Osce, you might be asked, administer a vaccine to a child of 6 weeks. So if you are not fast to articulate, and you know that every Osce exam has a station for answering questions, if you are not fast to articulate, you might make a mistake. So you need to be what? Fast and accurate. You need to think precisely. Your comprehension should be sharp. That is why we are having this quiz. In case you are not getting it correctly, please go back to the simplified lecture. Are we together? Now, at 9 months, a child should receive, at 9 months, a child should receive A, pentavalent vaccine and OPV vaccine, B, IPV and PCV, C, measles, rubella and yellow fever vaccine, D, rotavirus and hepatitis B vaccine. Which is correct? Which is correct? At 9 months, a child should receive A, pentavalent and OPV vaccine, B, IPV and PCV, C, measles, rubella and yellow fever vaccine, and D, rotavirus and hepatitis B vaccine. Which should a child of 9 months receive? And if you choose D, rotavirus and hepatitis B vaccine, you are wrong. Okay? I've seen what a lot of students are choosing. This is why it is a live quiz, so that you make attempts. And if you choose BA, pentavalent and OPV vaccine, you are wrong. If you choose B, which some students choose IPV and PCV, you are wrong. At 9 months, the right answer is what? C, measles, rubella and yellow fever vaccine at 9 months. Yes, some students got it correctly, and I'm impressed. The second dose of measles rubella vaccine is given at A 6 months, B 9 months, C 15 months, D 18 months. The second dose of measles rubella vaccine is given at A 6 months, B 9 months, C 15 months, and D 18 months. Make attempts. Every wonderful student, try and make attempts. Now, if you chose D 18 months for the second dose, you are wrong. If you chose 6 months for the second dose, you are wrong. If you chose 9 months for the second dose, you are wrong. The right answer is what? 15 months. That is when the second dose of measles rubella is given. A lot of students need to go back to this class. You need to go and listen to the simplified lecture I sent in the group. Is a private lecture group. Is a private lecture, but I intentionally made it public so that every student will benefit. Make sure you have invited your classmates to join this quiz, because this is a very important quiz that no student should listen to alone. Even the one I sent in the group, make sure you send it to your friends and your classmates, because immunization schedule is a big tactical course that students find difficult, and it comes out in exam. Now, which vaccine is administered orally at birth? Which vaccine is administered orally at birth? A, BCG, B, hepatitis B, C, OPV0, and D, PCV. Which vaccine is administered orally at birth? Which vaccine is administered orally at birth? A, BCG, B hepatitis B vaccine, C OPV0 vaccine, and D PCV. All wonderful students, drop your answer. I'm impressed with all the wonderful students that are dropping their answers. I'm impressed. Now, if you choose PCV, pneumococcal conjugate vaccine, you are wrong. If you choose BCG, you are wrong. If you choose hepatitis B vaccine, you are wrong. The correct answer is what? OPV0. That is the vaccine that is administered orally at birth. Are we together? Yes, we are together. Rotavirus vaccine is administered at rotavirus vaccine is administered at A, birth only, B, 6 weeks and 10 weeks, C, 10 weeks and 14 weeks, D, 9 weeks and 15 months. Rotavirus vaccine is administered at A, birth only, B, 6 and 10 weeks, C, 10 and 14 weeks, D, 9 and 15 months. When is rotavirus vaccine administered? And if you choose at birth only, you are wrong. If you choose 10 and 14 weeks, you are wrong. If you choose 6 and 10 weeks, you are correct. That is the correct answer. Now, next question. Pneumococcal conjugate vaccine, which is PCV, is administered at A, birth only, B, 9 months only, C, 6, 10 and 14 weeks, D, 15 months only. Pneumococcal conjugate vaccine is administered at A, birth only, B, 9 months only, C, 6, 10 and 14 weeks, and D, 15 months only. And if you choose D, 15 months only, you are wrong. If you choose at birth only, you are wrong. 9 months only, you are wrong. So PCV is administered, and if there is no, if after tonight's quiz you did not get anything, probably you've not listened to the simplified private lecture. Don't forget that PCV is administered at 6 weeks, 10 weeks, and 14 weeks. Let's recap it together. 6, 10, 14 again. 6, 10, 14. PCV is administered at 6, 10, 14. 6 weeks, 10 weeks, and 14th week. Yellow fever vaccine is administered through which route? Yellow fever vaccine is administered through which route? A, oral, B, subcutaneous, C, intradermal, D, intravenous. Yellow fever is administered through which route? A, oral, B, subcutaneous, C, intradermal, and D, intravenous. And if you choose intravenous for yellow fever, you are wrong. If you choose intradermal and intravenous for yellow fever, you are wrong. If you choose oral, you are wrong. So yellow fever vaccine is administered through subcutaneous route. That is the best route for administration of yellow fever vaccine. And the final question, which vaccine is administered intradermally? Which vaccine is administered intradermally? A, pentavalent vaccine, B, PCV vaccine, C, BCG vaccine, D, IPV vaccine. Which vaccine is administered intradermally? A, pentavalent vaccine, B, PCV vaccine, C, BCG vaccine, and D, IPV vaccine. This is the final question. And if you choose D, IPV for intradermal, you are wrong. If you choose pentavalent vaccine for intradermal, you are wrong. If you choose PCV, you are wrong. If you choose BCG as the vaccine that is administered intradermally, you are correct. So the vaccine that is administered intradermally at birth is what? BCG. Are we together? Hope we learned something in this quiz. Please, if you need a recap to rewatch, please take it back slowly so that you don't miss anything. Don't forget that yellow fever vaccine is administered through subcutaneous route. Don't forget that. PCV is administered 6, 10, 14. BCG is administered intradermally, not intravenous, not subcut, not oral. It is administered what? Intradermally for BCG. OPV is administered orally. 9 months we give yellow fever vaccine and measles vaccine. Hope you learned something. All right. God bless you. God bless you. God bless you. Let's go to the private lecture room. We have more lectures. We have lectures tonight. So we just want to have a brief quiz to assess the students' comprehension of the last class, whether they themselves as the wonderful students should go back and listen to the lectures again. That is why we are having a live quiz, so it has to be interactive. All right. God bless you. God bless you. God bless you. Let's move to the private lecture room.